We're here in the race clinic room where all our patients have their parts of their comprehensive assessment. So over here we have some physiotherapy, we have an occupational therapist as well. Behind me we have a nursing station where the nurses can do some basic tests like blood pressure. And we also have a pharmacist as well, and they look at the patient's medications and see whether they're taking them properly and whether there's any adjustments that need to be made. And once the patients have been and seen all of those people, then they'll come to see me in my clinic room where they have a comprehensive medical review. And we will then come up with a detailed plan to feed back to their GP.
When they move around to my post, the physiotherapy post, what I'm interested in is looking at their balance in particular. We also do some balance tests, look at their range of movement, power, strength. I also ask them about their transfers, so I might see them transfer on and off here, but I'll ask them about home and what equipment they might have. Each clinician will fill in just a little summary of what they've found for each patient, any actions, so I might decide that actually it would be useful to see them in the community in their own surroundings, or they might need a course of therapy. So I would put those recommendations down, and then once we've all done that, they'll be seen by the consultant, and he will have that information to hand.
My name's Christine. I'm the Senior Locality Pharmacist for the Medicines Management team in the east of Dorset. I see patients when they come in who have been referred to the race clinic and get an accurate list of their medications, and I explore with them their beliefs about their medications, whether they know why they're taking them, what their experience is, whether they collect them from the chemist, for example, if they need any help with deliveries, any sort of practical things like that. I clinically review the medications, and if I have any recommendations, I document them both on System 1 and on the paperwork and forward them on to the consultant, who then reviews my recommendations, and if he agrees, he passes those on to the patient's GP to be actioned.
Patients come and have a full nursing assessment, starting with a measurement of their height and their weight, and obviously we work out their BMI because that's important as regards to their well-being and frailty. And then we come into this room and they have observations, lying, standing and sitting BP to see if there's any postural drop, which is important in falls, and to check all their general observations. We also do a blood sugar as well in case they have possibly diabetes that's not been diagnosed, and we also do an ECG using this machine, and we ask questions about general nursing questions about nutritional status, about falls, about incontinence. So it's ideal that it's in a room where it can be kept confidential.
It's been running about 6 months. It came about because we know there's an increased local need for an ageing population who are developing ever more complex medical and social problems, and so when we're dealing with an elderly person, we have to really focus on the whole person and not just look at specific areas. They can have all their assessments done in one go, and what it does is we have very good links with the community team, so we can refer back to the community teams and they can have ongoing assessments if they need them at home. It saves them having multiple trips to multiple different people, and it gets it all done in one place, and as I said, it's a comprehensive assessment. It does take about 2 hours. It's quite a tiring afternoon for patients, but we've had some very good feedback on how it's running. People seem to like coming and find it a useful resource.